This next unit we're beginning, Unit 6, is neurological and neuromuscular agents. It's broken down by systems. The first one, this chapter, Chapter 20, covers the central nervous system, which is the brain and the spinal cord, and just going over medications, starting with the stimulants. So, according to your objectives, explain the effect of stimulants on the central nervous system, contrast or the common side effects of them, apply the nursing process to these stimulants. So, central nervous system are categorized in amphetamines, anoleptics and caffeine, and anorexiants. It's easy to remember anorexiants, or because it sounds like anorexia, and it is an appetite suppressant. And medically approved uses are attention deficit hyperactive disorder, narcolepsy, and reversal of respiratory distress. So, just going over briefly, attention deficit hyperactive disorder, your text does a good job explaining this. The dysregulation of transmitters of the serotonin, norepinephrine, and dopamine. Much more common in boys. It's usually diagnosed before age 7, but I know there's times when later teenage years or even adulthood, early adulthood, when it's actually diagnosed. Inattentiveness, inability to concentrate, restlessness, hyperactivity, inability to complete tasks, impulsivity. It's usually pretty apparent early on. They may have some learning disabilities along with it, although their IQ is fine. And narcolepsy is recurrent attacks of drowsiness and sleep during the daytime, unable to control sleep, falling asleep while driving, talking, eating, standing. My father actually had narcolepsy, and he could be eating dinner, carrying a conversation, have his spoon or fork on its way to his mouth, and he'd be asleep. He wouldn't drop the spoon. It was weird. And then he'd be awake, and he'd carry on like he was fine. There was another officer in the Army with me that had narcolepsy and had to take medications that we're going to talk about for narcolepsy. Interesting disorder. Okay, so how do the amphetamines work? They stimulate the release of norepinephrine and dopamine from the brain and the sympathetic nervous system that we just covered. They ordinarily would cause euphoria and alertness, but some people, it causes the opposite: sleeplessness, restlessness, tremors, irritability. It can affect the cardiovascular system with an increased heart rate, palpitations, dysrhythmias, elevating the blood pressure. Half-life varies anywhere from 4 hours to 30 hours, depending on which amphetamine it is, which totally affects dosing. Some of the side effects, of course, because the systems it affects with the cardiovascular, the GI tract, so they can have restlessness, insomnia, elevated heart rate, blood pressure, heart palpitations, dry mouth, anorexia, weight loss, diarrhea, constipation, and impotence. So obviously you would question orders for anything in this class for somebody hypertensive, tachycardic, if they've got a cardiac history, they complain of palpitations, or if they are taking the medication and they're having these issues. The amphetamine-like drugs that are used for ADD, and these are 2-methylphenidate and dexmethylphenidate. I know you probably know the name Ritalin. I don't think I've ever prescribed Focalin, but you need to know the generic names. So the methylphenidate, is the one you need to know, because the NCLEX is only going to give you generic names. I left both on here, but I'm going to try to make sure in the exams I do not put the brand name to get you used to it. But I put the brand name on here because you will see it written in scripts and things. So you need to be familiar with both, but you definitely need to know the generic name. The amphetamine-like drugs, in this class we're using for ADHD. Okay, I wrote in your class too because I want to go over the classes with you. There's 5 classes. They're classified by the DEA, Drug Enforcement Agency. So any drug, substance, or chemical used to make drugs are classified or scheduled. And when they say there's a class of the drug, that means they're a scheduled drug. So they're put on this, it has to do with their abuse rate on scheduling them. A Schedule 1 drug has a high potency for abuse and potential to create severe psychological or physical dependence. Schedule 1 drugs are no currently accepted medical use. Examples are heroin, LSD, marijuana, ecstasy, peyote. Schedule 2, Schedule 2 drugs, some examples, they have a high potential for abuse, with use potentially leading to severe psychological or physical dependence, considered dangerous. Some examples are certain doses of hydrocodone, cocaine, methamphetamines, methadone, hydromorphone, which you might know as Dilaudid, meperidine, which is Demerol, oxycodone, which is an Oxycontin, fentanyl, dexedrine, Adderall, Ritalin. So these are Schedule 2. Schedule 3 drugs are defined as moderate to low potential for physical and psychological dependence. Their abuse potential is less than Schedule 1 and 2, but more than Schedule 4. Some examples are codeine, ketamine, anabolic steroids, and testosterone. Schedule 4, substances or chemicals with a low potential for abuse, low risk of dependence. Examples are Darvon, Darvocet, well those are they're off the market, so scratch those. Soma, Xanax, Valium, Ativan, Tolwyn, Ambien, Tramadol. Schedule 5, defined as drugs with lower potential for abuse than Schedule 4, consist of preparations containing limited quantities of certain narcotics, generally used for antidiarrheal, antitussive, analgesic. Some examples are like Robitussin AC, because it has codeine in it, Lomotil, Lyrica, and that's pretty much it. Just nothing for you to memorize. You just need to be familiar with the classes of medications, understanding those are all scheduled medicines and controlled substances, narcotics with a level of abuse potential. And even though the DEA classifies them, each state has the right to bring them to a higher class. I mean, if it's a Schedule 3, they can make it a Schedule 2, but they can't make it a lesser class. They can't take a 3 and make it a 4. So if the state is having a problem with abuse of a certain drug, they can increase the class. Like one of those, it would be can't think, hydrocodone. Actually, I already said I think the Vicodin hydrocodone is made with Schedule 2 just because it didn't used to be. It's been so abused. and the Xanax is Schedule 4, but I think there's some states that actually make it a 3. Anyway, I'm going to move on from here. You notice that these drugs are a Schedule 2. An amphetamine-like drug that's used for narcolepsy. These are 2 of them. The methylphenidate, which was the amphetamine-like drug, and modafinil or Provigil, which we'll talk about in a minute. And the action and class, I'm just going to break them down and go over those. So here with methylphenidate or Ritalin, modulates the serotonergic pathways. That's a serotonin that's released in your brain that affects your mood, and by affecting the changes in the dopamine transport. It's used for ADHD, fatigue, narcolepsy. It is a class 2. It's a pregnancy category C, which most of these are. We'll get in a later section with some X's, but most of these in these classes are a C. Food may slow down the absorption, so it needs to be taken at least 30 minutes before breakfast. It's usually given like breakfast and lunchtime, unless they have a sustained release, which lasts through the day until bedtime. I think it's got a half-life of like 9 hours. It's excreted in the urine. It's well absorbed in the GI tract, but I said food interferes with it. It can be born in a transdermal patch, although I've never prescribed it that way. It's just too much of a drug of abuse. I would not put it in a patch. It's better for treating ADHD than amphetamines other than Adderall. It's sympathomimetic. If you remember, that means it mimics the sympathetic nervous system. Sympathomimetics, ones that stimulate the nervous system, will increase the potentiate or increase the effects, the stimulatory effects of methylphenidate. So that would be a contraindication to make sure they're not taking something like pseudoephedrine or caffeine because of the stimulation. Also, some of these drugs like this one work with inhibiting the MAO release, so it's contraindicated to take it with an MAO inhibitor. You want to be off an MAO inhibitor for a couple weeks before you start on one of these, or they can go into a hypertensive crisis. They're on page, there's a chart 20-1 that goes into more information concerning this drug. Again, increased effects of oral anticoagulants, which is your warfarin, which you'll keep, and MAO inhibitors, anticonvulsants. You'll see over and over with so many drugs interact with these things. Not to be used in children under 6 years old or with depression or substance abuse, and avoid in pregnancy. Even though it's category C, it's not recommended to be used during pregnancy. It can cause hepatotoxicity in some people. On your nursing process, they have the whole nursing process on 286, and it goes all the way through to page 288. Some of the precautions you're looking for: hyperthyroid, Parkinson's, glaucoma, the kind of things you'd be looking for with anything that stimulates the sympathetic nervous system. You're going to monitor their height and weight and growth in a child, because it can, in the long term, have effects on, detrimental effects on slowing down their growth. Look for side effects such as insomnia, restless nervousness, avoid any alcohol intake. Don't assume it's just children that take this, because adults can be on this also for ADHD. The problem with a dry mouth, teach them to have like lemon drops or something to help with the mouth. Don't abruptly discontinue the drug. It has to be tapered off, or they'll have severe withdrawal symptoms. Be very careful with taking things over the counter, because there are some medicines that have caffeine in them. Teach nursing mothers to avoid taking all central nervous stimulants such as caffeine. Diet, advise patient to avoid foods that contain caffeine. It's all about the caffeine. Okay, so I'm going to move on. Anorexiants. This is the class of them: benzathymine, diethylpropion, phentermine, 2 different kinds of phentermine, phendimetrazine, lorcaserin. And the side effects of these ones that are commonly used is the benzathymine. And this first phentermine HCl, which is pretty common right now. I've prescribed Belviq a couple times with those where instead of for appetite, I used them for some difficult to control diabetics. It's not an insulin. I was trying to avoid having to go to the insulin. They are for short-term use, only 4 to 12 weeks. Unfortunately, phentermine, I've seen some places that are given phentermine for long periods of time. Unfortunately, and the body forms a physical and psychological dependence on it. So that's why it should never go more than 12 weeks. It should only be prescribed 4 weeks at a time and a max of 12 weeks. Interestingly, that there's an increased risk of hemorrhagic stroke in young women, 16 times greater in women who take this, any kind of appetite suppressant, compared to men. It's very significant. It can cause acute renal failure, acute psychosis, hypertension, cardiac dysrhythmias. It's not a benign drug to be taken as lightly as it's being prescribed. Never given to anyone under the age of 12. In table 20-2, it goes over these medicines, and I want you to notice something on all of them. Every single one of these anorexiants are a category X, and they should be for short-term use only. If you notice on phentermine, it also has an increases suicidal risk. Analeptics. The 2 are caffeine and theophylline, and you should recognize theophylline from our lower respiratory medications that we just recently completed. It can be used in neonatals to stimulate their respirations when they're depressed, or theophylline is also used in the adult population to bronchodilate. Side effects are nervousness, restlessness, tremors, twitching, palpitations, and insomnia. There may be some other like GI issues, GI irritation, nausea, vomiting. Rare that they'll have tinnitus or ringing in the ears. Caffeine half-life is about 5 hours, prolonged in those with liver disease and who are taking oral contraceptives or pregnant. Respiratory central nervous stimulants. The one in your text is doxapram. It's used to treat respiratory depression caused by drug overdose, post and pre-anesthesia respiratory depression, and some COPDers. Used with caution in neonatal apnea. It is only given intravenously. Onset is 20 to 40 seconds and peaks in 2 hours. Side effects, of course, it's a central nervous system stimulant, so as you'd expect with any of these, hypertension, tachycardia, tremors. This one can also cause spasticity, hyperactivity reflexes, and it's better recommended to just use mechanical ventilation intubation rather than this drug to try to reverse. And that is the end of this chapter, and we can move on to chapter 21.